Hello everyone, my name is Sietske Berghuis, and today I would like to present together with Professor Arie Bos, and we are from the Department of Neonatology in the University Medical Center Groningen in the Netherlands. We would like to thank the organizing committee for inviting us to present our results from the Dutch cohort on the effectiveness of implementation of international guidelines on early detection of high risk of cerebral palsy. We would like to disclose that Professor Arie Bos is a tutor from the General Movement Trust, and the General Movement Assessment is one of the tools recommended in the international guidelines. Besides that, we do not have other things to disclose. Historically, cerebral palsy has been diagnosed between the ages of 12 and 24 months. Evidence-based diagnostic tools are available, such as the General Movement Assessment, the Hammersmith Infant Neurological Examination, and magnetic resonance imaging, MRI. Using these tools, identification of infants at very high risk of developing cerebral palsy can be made before 6-month corrected age. This is written down in the International Clinical Practice Early Diagnosis of Cerebral Palsy Guidelines in a scientific article by Novak and colleagues published in 2017. The aim of the study we would like to present today is to assess where the implementation of the International Clinical Practice Guidelines on Early Diagnosis of Cerebral Palsy result in a younger age at referral to a rehabilitation center. So this is part of the international study called Born Together, which is funded by the European Union, called Implementation of Early Detection and Early Intervention Service Delivery in Infants at High Risk for Cerebral Palsy to promote infants' psychomotor development and maternal health. And it has been done in the Born Together consortium, in which 9 partners were involved. One of them is the Netherlands, so that's where Professor Arie Bos and I currently are situated, Denmark, Italy, Georgia, Sri Lanka, and Australia. Besides that, we are also collaborating with some of your colleagues in Ukraine to also provide fact sheets in Ukrainian translation. So on the website of the Born Together project, the fact sheets are free available. We have different fact sheets, also on the background and classification of cerebral palsy, but also on possible early diagnostic tools and also management of associated impairments. The fact sheets are available in different languages, including Ukrainian. Besides fact sheets for about cerebral palsy for professionals, also fact sheets and resources are available for families. So now let's come to the current analysis. So here you can see a timeline in which it is displayed that we start implementation of these guidelines around 2021, and during the period of 2022 to 2024. We implemented them in the northern part of the Netherlands. That's included training of healthcare professionals on the practical qualitative assessment of the general movements during an in-person meeting of several days, the Hammersmith Infant Neurological Examination, neuroimaging, and there was also information about communicating of the diagnosis of high risk of cerebral palsy to the parents. So I would like first to introduce something about the inclusion of the Born Together project. In total, we screened 225 children at a neonatal intensive care unit. They had either a birth weight below 30 weeks, a gestational age below 30 weeks, a birth weight below 1,000 grams, or have clinical risk factors. And here we can display whether they are categorized as having a high risk, a mediate risk, or a low risk. Those children who have a high risk had, for example, abnormal general movement assessment and have high or low clinical risk factors. And this group is referred to the rehabilitation and also to start early surveillance and early intervention. So that's in total 21 of the children of those who were screened. So that's around 10% of our at the NICU population. So for the study group of the current analysis, we included children having a high risk of cerebral palsy referred below the age of 24 months. So we are only looking at those below 2 years of age at the Center of Rehabilitation of the University Medical Center in Groningen, and we selected the hospital declaration codes to select those who are mentioned as having a risk of developing cerebral palsy. And we were interested in whether before implementation the age was higher and after implementation the age of referral might be at a younger age. So we compared the mean age at referral between those two periods and also the proportion of children referred below the age of 6 months. So in total in period 1, 8 children were selected as having a high risk of cerebral palsy in the first period, and in the second period, which has the same time span, 23 children were referred as having a high risk of cerebral palsy. The mean age at referral in the first period was 12.5 months, and after implementation, the mean age was 8.3 months, so at a younger age. Then we are also, and it was also significant using a t-test. And then we are also interested in the percentage of children referred below the age of 6 months. In the first, it was 12.5%, and after implementation, around 40% of the children were referred below the age of 6 months. So the take-home messages of our presentations are that they are referred at a younger age after implementation of the International Clinical Practice Early Diagnosis of Cerebral Palsy Guidelines published by Novak. Besides that, family reported to us that they feel better informed, and there was an improved transition between the departments of neonatology to the rehabilitation department. Besides the project, there is also a larger spin-off of the project with the intention for implementation the general movement assessment and the HINE in the Dutch national guidelines. There's more awareness among stakeholders, and there is dissemination of the general movement assessment HINE MRI on regional, national, and international level. So international implementation can result in earlier start of intervention and better outcomes in children at high risk for cerebral palsy. I would like to thank all children and families involved in the studies, European Union for funding the study, my UMCG team from the Department of Neonatology, Child Neurology and Rehabilitation, and also the Born Together consortium partners. And I would like to thank you all for your attention. And Professor Arie Bos and I are happy to take any questions. Thank you.